Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Why is sleep so important?
If you think of ourselves and how you function, I think we all recognize that when you've had a bad night's sleep, you don't feel as good the next day, and you're not going to function as well. So when we look at a child and we look at what are the things that they are doing in their lives, I mean, whether it be a young child or an older child, I mean, obviously we think about school, and school performance is important, we want to believe, for their future. And so it's really important that children in general get a good night's sleep so that they can function as best as possible during the day, so that they can perform as best as they can in the school setting or any other setting that they happen to be in, whether it be on the basketball court or whatever activities they may be involved in.
As a child grows, do they need more sleep?
The younger the child is, typically we think the more sleep they need. I mean, infants and toddlers are usually thinking about 11 to 12 hours of sleep a night or so, possibly even more. Some infants actually go well beyond 12 hours in the first few months of life. And as the child's getting older, you start to see a decrease in the amount of sleep that they're getting. I think that the biggest challenge in terms of amount of sleep one considers for a child, it is when they reach the teenage years, because in the preteens, you're usually thinking they should be getting about 9 to 10 hours of sleep. In the teenage years, everybody assumes that they should be able to get by with 8 hours or 7 hours or whatever the adults may be doing. But in all honesty, teenagers actually need as much sleep, potentially even a little more, than the preteens. And so they need really, ideally, up to 9 hours. I mean, that can vary from person to person, and some might need a little less and some might need a little more, but 9 hours is a good number to think about. It's really good for, I think, parents, teachers, and even in the medical community to realize that the adolescent really is better off sleeping a little later than what they're currently allowed to sleep with their current school schedules. They would be much better off if they were able to sleep until 7 in the morning or even 7:30, getting that 9 hours of sleep that they may need so that they could then get to school and function at their highest level.
What are the most important sleep habits to instill in a child?
Having a consistent bedtime, not having a lot of variation on the weekends, recognizing that if you have late bedtimes on the weekends, you're more likely to have a little trouble falling asleep during the weekdays. And so that consistency is really important. Trying to establish at a younger age that the child learns to fall asleep on their own, and really starting even before the age of 1, where the child learns to fall asleep on their own without the parent having to be in the room with them. Considered a developmental milestone to be able to fall asleep without a parent having to be present for that. And so it's a nice milestone to achieve for the child, but also for the parents.
How can a parent detect sleep problems with their child?
The first thing is breaking it down into, what might be happening at night and then what might be happening during the day. So when thinking about the nighttime, does your child snore? Does your child have just a lot of sleep disruption where they're awakening frequently? Do they sleepwalk? Do they have other things that are just leading to them being up more at night? I mean, so those are sleep problems that probably ought to be at least considered and brought up maybe to their primary care physician. Daytime, I think, is the child sleepy during the day? Are they falling asleep at school? Are they falling asleep during car rides? Or even watching TV, they can't stay up for that. Are they getting their homework done? Are they able to get it done without falling asleep or having to go to bed because of their sleepiness? So, I mean, those are things that are worth kind of considering, is functionally, how's the child doing? Another thing that some kids who have ADHD might potentially have a sleep disorder. Not to say that every child who has ADHD has a sleep problem, but it's worth considering in the child who has ADHD, what's their sleep like? And if they happen to have in their sleep history some concerns about their sleep, then it's worth addressing, because you might be able to help their daytime symptoms of ADHD just by helping their sleep.
Is co-sleeping a good idea?
It's important to look at the risk for SIDS, sudden infant death syndrome, and there being a higher potential for this in the household where there is co-sleeping with an infant. So with that information, it's better to not encourage or to even discourage co-sleeping with an infant, because that's the last thing anyone wants to see happen. For the toddler, the SIDS risk is not there. I mean, that's really in the first year of life. So we can't use that as a reason. But I think it's just worth recognizing that sleeping in the same bed as a parent, there's going to be some risk that it's not going to be the same quality of sleep as the child may otherwise get if they were in their own bed. So how do we optimize quality of sleep? And I think one way is to consider encouraging that the child have or sleep within their own bed. Having said that, there are certain cultures where this is the norm, and I think it's worth being sensitive to the fact that this may not be unusual, and it may still be something to be aware of in certain cultures that this is maybe common.